Hey everyone, this is the start of a special series of bonus episodes that are based on recent conversations, posts, and ideas. The idea here was to share my take on the impacts and value of making healthcare more consumer centered. After all, why are we on this mission? What do we hope to accomplish? What's the goal? What are the objectives? And how is that answer different depending on what audience we're speaking with? So, this is the first in that series, and this episode is going to be addressed to health system leaders. So, I'm going to share my top 5 pieces of advice for health systems, again, about what the impact is of making healthcare more consumer centered. So, without further ado, here's number 1: the impact on growth strategy. Consumer experience is a differentiator, not a distraction. This is a long held thought that I've had, and it comes to the core of what we're doing here, of what we're talking about making healthcare more consumer centered. What does it matter? How does it make a difference here? And I will continue to put this idea out there into the universe that the quickest way to differentiate a healthcare brand is on consumer and patient experience. Now, that also means that a lot happens when you're not an active patient, when you're not actively seeing a doctor. There are a lot of resources and a lot of communities and a lot of focus on patient experience. So between the two, and we do make that distinction between patient experience and consumer experience, between the two, the focus on that is what can become a differentiator. And we have to always bring up that factor, that disclaimer, that doesn't always mean the pieces of or the individual encounters or touch points associated with just the patient experience. And I do say just because that's rarely the piece that we're happening or engaging in or going through on a daily basis. For some patients, that is the case. But for most consumers, most of us, that is not the case. That is not what we're dealing with on a day-to-day basis. So the relationships that lead up to an appointment, or maybe some of the traditional marketing touch points, marketing objectives and KPIs, those relationships that lead up to those, the relationships leading up to appointments are formed long before those appointments. And they're usually not in the ways that traditional marketing has kind of either just operated on. I know we don't assume it, but we just kind of operate on the fact that, yeah, here are the things that impact those moments. So what does that mean? Well, the idea of journeys as opposed to funnels is something that's come up recently in a few conversations. And I'm really glad for that because I do think that's how we need to think of things. It just really changes a marketing focus, for instance, but it also changes an experience focus. So at a health system, at a leadership level, when you are acknowledging that a journey happens and that the number of touch points that impact somebody's decision to actually even seek care, the number of touch points there is so much greater than a single ad campaign or, a brand, any kind of branding or any kind of marketing, really. It's a sum of so many different touch points. Now, a few weeks ago in the Flavor of the Week, I talked about the idea of journeys, and I talked about the whole adage of skate to where the puck is headed, right? I mentioned that the puck is moving towards orchestrated journeys, which means truly personalized, connected engagements that more earnestly address our expectations as humans. And I put it out there that I suggested that the best case is when health systems and consumers can co-orchestrate those journeys for the same reason that the conventional wisdom is for a patient and a primary care team to address their health together. It's really the best of both worlds, right? We get the expertise and human touch of traditional care when we need true patient encounters, and we get the convenience and simplicity that we've always wanted in between visits. So just remembering and acknowledging that consumer experience is a differentiator and will continue to be for, I would venture, at least the next decade. We're just scratching the surface. We're still talking about pretty basic things like access. Until we even get to a better place there, we're going to be talking about this for a long time. So I do hope that comes sooner than later, but that's the reality right now, is that we're not there. So right now, any step you can take in this direction of consumer experience is absolutely a differentiator. That's a piece of your growth strategy. Okay, number 2, the impact on digital transformation. The thought here is pretty simple. It's that consumer expectations aren't an obstacle, they're an accelerator. I've shared a little bit about this on LinkedIn recently, but there was a really simple thought, and I was addressing hospital and health system leaders there. But the thought was that if you're trying to transform the way that you engage consumers, there's a good chance that you're struggling with change management. And that's really the focus here when we're talking about digital transformation on any level: clinical, non-clinical, the business side, the marketing side, the engagement and experience side. Anything to do with that, we have to get better at change management, and we have to acknowledge that that is a muscle that we have to build up within our organizations. That process is usually so complex that when somebody says, You need to involve the voice of the consumer. People just shoot it down because they think it'll add complexity. They think it will slow down the process even more. And I get where that's coming from, but the reality is, and this is a positive thing, the reality is that when stakeholders hear the voice of the consumer loud and clear, when they know what patients want and what they're frustrated by and what they expect, suddenly the reason for change feels real. And you realize that consumer expectations aren't an obstacle. That's when you realize that they're an accelerator. What do I mean by that? How does that relate to change management? Well, the more you include consumer expectations in your change management process, the faster and more effectively you can reach your digital transformation goals. And that can include KPIs that come up frequently, everything from greater patient loyalty and retention to reduced reacquisition costs to making the most of your technology investments. So it doesn't have to be complex, it doesn't have to be complicated. We just have to acknowledge, folks, that change management involves the people who we are changing on behalf of, meaning, yes, providers and staff and clinicians, but also the consumers, the patients that we're serving. So we can use that voice of the consumer to kind of be that rallying point. I've seen it many times where having that data, understanding a broader picture, a broader view of what is bringing somebody into an orbit that involves seeing a healthcare professional to help them on their health and wellness journey. At that point, you realize that you're uncomplicating transformation. It feels more doable because you not only have the reason for it, but you have the data for it. It has everything to do with the consumers you're trying to serve. So again, when we're talking about digital transformation, the effect of becoming more consumer-centered is that you accelerate that progress and that transformation. All right, let's keep going. Number 3, team development. What's the effect on team development? Well, the thought here is that every marketer is now in the experience business. And what do I mean by that? Well, historically, I think a lot of you will agree with this. It's been too easy for marketers to ignore the friction that they create in the consumer experience because it's just too easy to be out there spamming at will and caring more about dashboards than the people who those data points represent. So while this is focusing on marketing team development, it has to do with everybody. In healthcare in particular, people can tell whether or not an organization cares about them. So the little stuff counts a lot more. That friction anywhere in the experience is magnified when someone isn't feeling well. So marketers in particular have to consider how they're affecting someone's desire to engage in their health with every encounter that they're creating. So I'll give a quick shout out here because I posted something on this topic on LinkedIn recently, and Sam Searing from Epic chimed in and he said he's seeing this topic in every conversation that he's having with health system marketing leaders. And his advice was, he said it can no longer be just about getting a lead to a landing page and then hoping for the best. And I just love that because I think we've all been there, right? We're just like, we're acquiring, we're focusing on who to target, and we're looking at our models and we're looking at the data, we're looking at dashboards, and we just assume that once they get to that page that they will know what to do from there. But Sam went on, he just said we need to consider engagement and experience orchestration. Those are things that they need to consider. And of course, based on the, my experience in the last year, I would most certainly agree on the need for experience orchestration. And then Sam also went on to say that this also means that the network of folks that a marketer works with and the skill sets need to expand as well. I couldn't agree more. That's where the team development piece here comes in. And the fact that you're talking about making healthcare more consumer-centered, basing it on the needs and expectations of the people you're serving, this is very familiar outside of healthcare. And yet we're still just thinking about that and needing to understand the value of it. So again, this just has to do with the fact that every marketer should see themselves now in the experience business and use that for their own development and the development of their teams. Number 4 is business model innovation. Now, what's the impact here? Well, I will make the case that the momentum behind the move to prevention and wellness dwarfs anything that we saw at the peak of retail health a couple of years ago. There are a couple of foundational principles involved here. One is for sure that disruptive innovation, requires disrupting your existing business model in order to allow yourself to succeed in the future because of the market that you're dealing with. So disrupting yourself is not easy. It's not a thing most healthcare organizations will really put much thought to, at least at scale. Maybe it's an experiment or an innovation team addressing it, but they're not typically thinking about that at scale. But in reality, that's exactly the way to prepare for the future and win over consumers who aren't yet seeking your services. It's this whole concept, again, becoming more consumer-centered in our strategy and in our approach to healthcare from all angles helps us realize the gaps. It helps us realize who is out there not even seeking care at all yet. So that's the focus. Like that's those net new consumers who are entering healthcare who have either just learned to not trust the system or don't have access or don't have the tools to navigate their way through the system, which is also very common. So that's who we're talking about. That's who we're addressing. And the fact is that market continues to grow. And a lot of these areas we're referring to are wellness or preventive areas. On the show for this whole last season, we've addressed the need to consider partnerships from health systems to at least have a play, have a presence in healthcare adjacent areas, everything from connected fitness to nutrition to sleep management, weight loss, metabolic health, mental health, and other preventive and wellness areas. These are all related, a lot more in a consumer's mind. And if we only think about a patient who is actively seeking the care aspect of healthcare, then we miss these opportunities to gain trust, to influence those journeys, and help direct people to care that they need right now. And so again, just the comparison to retail health, which as we all know, for those of us, who are flag bearers, admittedly, of some of the brands that made billion-dollar investments in retail health, and to their credit, some that are still in the space, the whole concept of retail health was just so simple and made sense. And, it's so unfortunate in my mind that the brands were not able to make it work. The brands that have made most of those investments. Now, again, there's still a handful that are still actively addressing care and have offerings out there. CVS just announced a $10 billion plan over the next, the next 10 years, something like that. So they're going to continue to invest in here in this space. But that's really where the future is. When a consumer, again, this helps us better understand who we are serving here. When a consumer is more likely to seek out a GLP-1 medication or a telehealth appointment, or they're looking for a health at home program or food as medicine program or direct primary care, some of these more consumer facing services, then that just says, a health system can easily say, well, those aren't, any of our service lines. They're not under our centers of excellence. They're not a high contribution margin procedure. Our doctors, don't know how to get reimbursed for some of those, or they're just not related to what we do. So we're going to ignore them completely. But the very core of business model innovation now and preparation for the next 5 to 10 years has everything to do with being able to innovate and partner on services like this that address some of those needs in a low acuity environment and gain that trust back and become an entry point for a journey to now more directly intersect with healthcare services from your health system. So that momentum is something we have to pay attention to, and it will influence the innovations that we see. Again, that momentum behind the move from regular sick care to preventive and wellness care. All right, so number 5 here, personal development. What's the impact and value of consumer centrism on personal development for anyone in this field? It's a piece I hope we're talking about more, and I hope we continue to think about it this way, because the concept here is that being a source of trusted information is a moral imperative and one of the quickest paths to fulfillment in this field. Folks, I've shared this since episode number 1, 7 years ago on this program, but I have a lot of empathy for those in the field, for those at health systems who are understanding this dichotomy of the current healthcare business model and the patients who we're trying to serve. That's one of those things that's so unique about those in the healthcare field, is that we're not just trying to get people to buy more things. There's typically a service mentality. There's typically something in our hearts and minds that makes us want to serve people, that leads us to be in this field, in addition to, or maybe even in spite of, the system that's around it. Let me look at this from one angle, and it's from the angle of hospital websites in particular. This has been a topic on LinkedIn in the last few weeks, and there were a couple of kind of points and counterpoints shared recently about what's the value of hospital websites in this age of AI tools, generative AI tools, getting answers and keeping you on pages more, Google search engine result pages, leading you nowhere really, 0-click experiences there, and overall a lot less traffic coming to websites from search experiences. And one of the perspectives that I really respect here was from Amanda Todorovich from the Cleveland Clinic. And she just recently published an article on LinkedIn. It's titled, "Why Trusted Health Content Still Wins in the Age of AI." She said, "As someone who leads digital marketing for one of the world's most trusted health systems, I've watched search evolve in real time. Google's AI overviews are shifting by the hour. AI companies are scraping our content more than ever. The old playbook, already obsolete. And I'm hearing the questions echoing across the industry. What happens if search goes away? Will AI kill our traffic? Let me be clear. This isn't a collapse. It's an inflection point. Platforms change. Consumer behavior and expectations change with technology. But what doesn't change? The need for accurate, accessible, patient-centered health information." So she goes on to say that yes, traffic matters, and so does revenue, but so does relevance. And the truth is that AI is nothing without high-quality content. So as we test, adapt, and explore what the future might hold, her mantra remains, beat yesterday, because the definition of winning changes every day. So I just thought that was a perfect thing to insert in this conversation because it shares a couple of things with me. The first one is the point she was making of this current questioning of the things we've built up, the digital assets, in Cleveland Clinic's case, the trusted health content that has been created here for years and years and years. But what I also heard in there was that moral imperative was a validation that Amanda cares, right? It's this whole thought of we should be sources of trusted information, not misinformation or disinformation. We should be part of the solution here. So take that as a challenge personally and see where that takes you and how it helps influence your influence within your organizations and within the industry. Okay, so quick recap. This was my top 5 pieces of advice for health systems and helping them understand the impact and value of making healthcare more consumer-centered. First, we talked about growth strategy and how consumer experience is a differentiator, not a distraction. We talked about digital transformation, where consumer expectations aren't an obstacle, they're an accelerator. We talked about team development, where every marketer is now in the experience business. We mentioned business model innovation and how the momentum behind the move to prevention and wellness dwarfs anything that we saw at the peak of retail health. And we talked about personal development being a source of trusted information and how that's a moral imperative and a quick path to being fulfilled in this field. So I'll just leave by saying consumerism is not a threat. Consumer transformation, where we are now, that's where I hope we see it as an opportunity. I hope we can learn from all these years of approaching it less effectively. I hope future generations will see that and are beginning now to design and build and market healthcare differently. That's our conclusion here. I hope you've enjoyed this. I would love to know if you like this format or not, or if you have any questions or responses to the topics here, please let me know. And in the meantime, stay tuned for the next couple of episodes in this series, which will be my top advice to consumer-focused digital health companies and to health consumers themselves.